Welcome to our video of the Chedoke Arm and Hand Activity Inventory. Throughout this video, we will be looking over a few things. This includes how the assessment is conducted and how a client is scored. The neurological structures involved in the test are also covered for both the person with and without hemiparesis. And finally, we will go through a brief and fairly simple mechanism of how movement is conducted in normal and an affected client. Part 1. The assessment.
Hi Norma, I'm Greg and I'm your occupational therapist for today. Do you know a bit about what occupational therapists do, or have you worked with them before?
Yeah, I have worked with them.
Okay, rightio. So today we're going to be doing the Chedoke Arm and Hand Activity Inventory, which measures the function of your left and your right upper limb. And I think that's a bit relevant for you today because I noticed you had a stroke about a year ago, and it says you're having trouble with some of your tasks at home. Can you tell me a bit about that?
Yeah, since my stroke, I can't really bend my right wrist or fingers, so things like buttoning, cooking, cleaning, those types of activities I can't complete anymore.
Okay. Well, this assessment we're going to do today is going to measure your function of both your affected limb and your unaffected limb, and we're going to see from this assessment what we can do for you and what supports we can put in place to help you achieve these tasks at home.
Sounds good.
Okay, Norma, for our next activity, what I want you to do is to be able to pick up the phone and dial 000 with the other hand. Can you please do that for me?
Yeah.
Using just your hands. Good. Awesome work.
The CAHAI 13 goes through 13 different tasks that a client is asked to perform. From what we have seen, this also includes drawing a line with a pencil and ruler, pouring a glass of water, wringing out a washcloth, buttoning up a shirt on the client, drying your back with a towel, placing toothpaste on a toothbrush, zipping up a jumper the client wears, cutting resistance putty with cutlery, cleaning a pair of glasses, lifting a box from the floor to the table, and finally, carrying a bag of shopping up a flight of stairs.
For our next activity, Norma, what I want you to do is to pick up this ruler, place it in the middle of the page, and to draw a line all the way across. Can you do that for me?
Yeah.
There we go.
The Chedoke takes both the independence of the task performed and the role of the affected hand into consideration. Clients such as Norma are already adapting to their environment with or without realising it. Carefully watch Norma in this next segment of the assessment to see how she's adapting to her hemiparesis already.
Okay, Norma, for the next activity, what I want you to try and do is to grip this mug, however you please, and pour yourself a glass of water. There we are. Can you do that for me?
Yeah.
Good.
In this activity, we can see that Norma tried to stabilise or grasp the cup as best she could with her affected hand. The role of the hand would be stabilising or grasping the cup. On the score sheet, the assessor would note that the role of affected hand is to hold the cup.
Okay, Norma, for our next activity, what I want you to try and do is to pick up this washcloth and wring it out using a twisting motion. See how my hands are twisting like that?
Yeah.
That's what I want you to try and do. There we go. Have a turn at that. That's good.
In this assessment, we can again see the client trying to adapt to her deficit. Norma uses her affected hand as an anchor for the other in order to squeeze the water out of the cloth rather than use twisted motion suggested by Greg. Each activity is scored out of 7, 7 being the most independent and needing no assistance, and 1 meaning needing full assistance, so they are mostly dependent. Each activity has a fully descriptive scale in the CAHAI manual that the assessor can refer to after the conduction of the test. This means that the assessor needs to take careful note of what the client does in each activity. In this scenario, Norma would receive a 2 out of 7. Part 2. The neurological mechanisms. A Chedoke is designed to test the function of someone when there is a deficit in their arm, hand, and wrist. Function can be described as the ability of someone performing a physical task. Function requires movement, and movement of the body requires processing in areas of the brain. These areas are called motor association areas. They are present in both hemispheres, making them bilateral, and they are all found in the frontal lobe of the cortex. The main motor association area is the primary motor cortex. This is located on the precentral gyrus. This area is responsible for initiation of movements that are voluntary. The supplementary and the premotor cortex also have major roles in planning movements and habitual patterns such as driving a car. Other areas of the cortex that are involved are the sensory association areas. These areas inform the motor areas of our position in space and how to react to a stimulus. For example, we can see and hear a person talking, which is sensory information, but our reaction would be to talk back, and that requires movement. Other areas, such as the thalamus, play a role in relaying the sensory and motor information to the right region of the body. The spinal cord is also a vital part for movement. The aim of the body is to connect a message created in the brain to get down to the wrist. First, the brain needs input from sensory receptors in various different regions of the body. The receptors then send information through the thalamus to the sensory association areas. They are then sent back to the thalamus, where they are relayed to the motor association areas of the brain. The motor association areas decide what action needs to take place in response to the sensory information received, and sends a signal again back to the thalamus for more relay to the body parts. This message is then carried down the spinal cord via the lateral corticospinal tract, which is a nerve pathway that sends messages through to the peripheral of your body. The message then exits the spinal cord at the cervical section via a motor or an efferent neuron. The message will then travel through the brachial plexus nerves down the arm to the wrist via either the radial or ulnar nerve. The impulse will finally meet a neuromuscular junction where the message is passed from nerve to the muscle. The muscle, with a number of chain reactions, will relay the message down to the actin and myosin of the muscle, telling it to either relax or contract. This leads to wrist flexion or extension. A stroke is a blockage or a leakage of blood to the brain. The overstimulation or understimulation of the cortex causes tissue damage or death. On this diagram, you can see where and how many blood vessels there are in the brain. Blood vessels going up the central gyrus can easily be blocked or leak blood flow to the primary motor and sensory areas of the brain. Damage to these areas would lead to an inability of a person being able to process or initiate movement and may have decreased sensitization. This explains Norma's and many other stroke clients' behaviours. The Chedoke Arm and Hand Activity Inventory tests the functionality of a person's functional and dysfunctional arm or hand. The Chedoke looks at both the role of the affected hand and the functionality of it when performing common ADLs such as putting toothpaste on a toothbrush. A client that is eligible for the Chedoke has a hemiparesis in their arm or hand due to the presence of a stroke or other trauma. A stroke is a blockage or leakage of blood to the brain. The motor association areas are responsible for the control and processing of voluntary movement, and they are often what is affected post-stroke.